Hi, welcome to the Kiwi Orthotic Services template series. Today we'll be looking at the unloader and the sensitive designs, which are the go-to designs for feet that need a more accommodative orthotic therapy. Due to the layers and thickness of these materials, in general, a deeper, more accommodative pair of shoes is recommended to accompany the device. While the shells in both cases are an EVA foam, the templates have a very different feel and function. Starting with the sensitive, this is geared towards patients that require just the softest, most accommodative support. The base is a small profile shell with the lowest density of EVA that we carry, 35, which is great for feet that are hypersensitive and mostly require pressure distribution instead of motion control because it is quite soft. The backing or mid layer is a full length layer of 3 mm Poron XRD, which functions like memory foam to provide relief throughout the foot for dynamic or shifting hotspots. The top cover is a 3 mm layer of plastizote or P-cell, which is a soft foam that compresses easily under pressure, allowing the foot to continue to dynamically mold the orthotic throughout its usage. It also has an antimicrobial coating on it that makes it ideal for neuropathic patients and diabetic wound care. In the unloader style, it's a similar in its material makeup, but very different in a lot of important ways. We have a large profile shell built from a firmer EVA 55 durometer or hardness that helps provide more integrity, more support, more structure. It's just a more robust design. The backing layer, mid layer, is a 3 mm PPT or Poron cushioning, and the top cover is a slightly slimmer 1.5 mm MC puff. It is actually a great daily use soft shell, and it'll hold up for several years in most cases, where with the sensitive being much softer, tends to pack out after about a year. As long as you're fitting this into a shoe that's going to accommodate this type of depth and width, this can be a great design. And it's certainly, because it's a foam based orthotic, less temperamental than the more rigid polypro or graphite designs. One final note about the shells: when you are going through the order form, the templates will default to what we call direct milled EVA foam. And you'll see it on the order form as just direct EVA 55, direct EVA 35, etc., versus the old style vacuum pressed models, which we would vacuum press a layer of material and then we'd often be filling in the arch with a PPT or some other EVA to give it some integrity. With the direct, it's all one block, it doesn't have that multi density. If you would prefer the shell to be one density, like an EVA 55, and then the arch fill to be a PPT, just switch the shell type from direct EVA to EVA. And then in the additions modifications sections, select an arch fill of the appropriate type. And if you have any other questions regarding these designs, certainly reach out and let us know. We're happy to answer any questions or consult on cases as needed, especially for the more complex cases. The more information we have about the patient and the shoe that the orthotics is going into, the better device will be able to get you at the end of the day. All right. Cheers.